On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way.
Welcome to Health Her Way. I'm Meredith Cunningham.
And I'm Brooklyn Elbert, and today we're joined by Darla Porter. Darla is a nurse practitioner with Covenant Health, specializing in medical oncology at Joe Arrington Cancer Center, where she has worked since 2003, focusing on treating patients with breast cancer. So thank you for joining us today.
Thank you for having me.
We've all heard of cancer before. It's a common word. We all, I think, probably throw it around in general conversation. And yet I don't know that many of us actually understand what is cancer. What does it actually do to our bodies?
It is the disruption in the cell growth of normal, healthy cells. So one cell can kind of go rogue, shall we say, and it could be for lots of different reasons, genetic factors, exposure to environmental factors. But once it kind of goes rogue and gets carried away, it brings other cells with it. And then that's when we see the growth of an abnormal mass and then a diagnosis of cancer once we get that biopsy.
This may sound like a silly question because I feel like it's so different. But what are the symptoms of cancer? I mean, besides recognizing that you have a lump somewhere, what is it going to do to you that's going to tell you something might be a little off?
Yeah, patients get real confused because they're like, well, nobody detected this on my blood. Well, it doesn't necessarily show up on the blood. It can, but it doesn't necessarily. People think if you have that any cancer is going to show up in the blood, and that's not necessarily the case. In breast cancer, if you're going to detect it yourself, then it's going to be a mass or a lump in your breast or under your armpits. We usually tell people that it feels like a frozen pea or maybe like a little spiculated rock, like a rock that has not smooth edges. And it could be very, very tiny. But women have a lot of cysts, so we have a lot of cysts related to caffeine intake. So sometimes your doctor will tell you, hey, back off on the caffeine, and then that little spot goes away. But what you're looking for is something that persists. So it's there all the time. It's there every time that you check your breast. Sometimes when you are on your menstrual cycle, things feel a little different, but it's present all the time. And then, of course, if it grows, then this is not normal and you need to have it checked out. Still, it could be a benign cyst, but if it is cancer, the earlier we detect it, the better we do.
So is there an average age when a woman is diagnosed with breast cancer?
I got two different responses to that. So I got a 66 and a 62 when I was looking at the data. But breast cancer is supposed to be a disease of older women. And unfortunately, those of us that are in our 60s don't feel like that's an old age. But it's supposed to be a disease of older women. And then when younger women get it, of course, it's more aggressive and not impossible to treat, but sometimes harder. And so that's what the average age said it was.
So why is it more aggressive for those younger women?
For some reason, it tends to be triple negative. So when we talk about breast cancer, we always want to know about hormone receptivity. So that has to do with estrogen receptor, progesterone receptor, and then HER2/neu. Those things tells us a lot of things about that particular kind of cancer. And in younger women, they tend to be triple negative, which means all those are negative, and we can't do any kind of pills. It's all chemo. Or they're HER2/neu positive, and that's a little bit more aggressive than if it were HER2 negative. And for some reason, we find that in younger women. So it's not impossible to treat, but it's obviously a little bit more aggressive.
So what is causing more young women to get cancer? Is it a lifestyle choice or something that we're doing? You're shaking your head. Okay,
Well,
tell us what not to be doing.
Right. Because there isn't a true answer for that. And even as much research as I looked at, it's all kind of the same. It can be definitely lifestyle related. So you want to stay at as close as possible to your ideal weight. So the more body fat you have, the more estrogen you have. It has to do with smoking, alcohol. So, not that you can't ever do it, but not in excess. And the other things that we don't know is that sometimes the patients don't know if there's a genetic risk. So it really talked about talking with your family about what's your family history. And I know some people don't like to talk about that. Some cultures may not like to talk about that because, if you talk about it, then you get it, different kinds of things like that. But it's real important to know that, do you have aunts that have breast cancer? Do you have grandmothers, grandfathers? Is there cousins? Anybody in your family that has a breast cancer diagnosis, that should be kind of a a red flag to you. And then, of course, doing good exams on your body, which, again, some women may feel comfortable. Young women may be comfortable doing that. Some maybe not. And certainly if you find something abnormal, seeking attention and getting into your primary care doctor and talking about it. Don't let that be. You'd be surprised how many women we see that come with very large masses that we know have been there a very long time. And they're like, I think they thought it was going to go away. I don't know if they were ashamed. I don't know if they were afraid to ask. They didn't really want to know. I mean, the sooner, even if it's nothing, we would way be more happy to see you and tell you it's absolutely nothing and go on with your life and be happy. Or this is cancer. We're going to get it out. We're going to get it early and it's going to be good.
So Brooklyn and I are obviously not old enough for mammograms yet, and we'll get there in a second. But, at my annual wellness check with my OBGYN, she does a little feel up, and shout out Dr. Henderson. Thank you for checking on me. But that's only once a year. And I'm guessing you're going to tell us that we need to be checking way more than that, correct? So how often are we supposed to be doing self-checks?
Once a month, and preferably after your menstrual cycle. So a week to 10 days after your menstrual cycle, because during your menstrual cycle, you can feel lots of little different things that aren't necessarily anything to get excited about. So, but once a month, like a week after your menstrual cycle. And even if you forget, I mean, I know we get busy, we have busy lives if we're in college and at school and working and doing those things. But, even if it's 3 or 4 times a year, every other month, I mean, anytime you think about it, but ideally would be once a month.
Ladies, if you're alone in your car, doing nothing right now, maybe give yourself a check.
Yeah.
Just a reminder.
Or in the shower, or first thing when you wake up in the morning. If you're not a person that just jumps right out of bed, that's also a good time because typically you're not wearing a bra and you're in bed and so you're laying flat. That's a good time. Or like you said, and the shower is a great place also. So
Darla jumps out of bed. I see her at the gym in the morning.
yeah, some of us jump out of bed. There's no time for that.
Darla's workouts are way harder than mine are, though. So speaking of workouts and speaking of that, we talked about some lifestyle choices to avoid, but I mean, not that anybody can necessarily prevent cancer, but what are some things that we could do to maybe help?
Like I said, I think, keeping your weight in check. It's certainly, you don't have to avoid all alcohol, but obviously not in excess. Smoking is also, not necessarily directly related to breast cancer, but all other kinds of cancer. So, it's just not a good thing to do. Trying to eat as healthy as possible. There's a lot of data out there and websites that say, sugar feeds cancer, so don't have any sugar. There is no truth to that. But again, you don't need to eat a whole cake. I mean, I think most of us know that. But I mean, there's just things we can do like that would help ourselves. And, exercising is always a good thing, getting some physical exercise and moving.
So we talked a little bit about self-checks, but, it may be harder to feel a lump or a mass in someone with bigger boobs as opposed to smaller boobs.
Mm-hmm.
So I guess, is cancer harder or easier to detect in women with smaller or larger breasts?
I don't think I don't think it goes either way. I was just talking to the lady that was doing my mammogram. And I think a lot of times if you have larger breasts, my assumption is it's easier to have a mammogram. But she says sometimes they have a lot of what she called it wrinkling, which I thought was kind of interesting. And so they have to do a lot of, so they always go and check. And then if they see something that doesn't look right, they always, redo that area that doesn't look right. For those of us that have smaller breasts, I always think that, it's not as effective. And she said, actually, she thinks she gets clearer shots on women that are smaller breasted. So I think if you're larger breasted, you might just be asked to, you might stay longer getting a mammogram just so that they can make sure that they can see all the area. But I don't know that there's really an advantage or disadvantage to either one.
Okay. So speaking of hard to detect, for those women who maybe have smaller breasts and then get an implant, does the implant, I don't know, does it like magnify and help you see it, or does it get in the way and make it harder to detect?
I think it gets in the way. And so sometimes you just have to have a good mammography team and the radiologist. And then, of course, if they can't see what they need to see, there's always ultrasound. And then sometimes you do have to have a breast MRI to see better.
Those are like probably extreme cases, though, not things
Extreme
that everyday
cases.
women are going to run into.
No, not everyday women, no.
Okay.
So the average age the woman should get a mammogram is 40 to 49.
Mm-hmm.
With the rising case in breast cancer in younger patients, would you suggest patients getting screened earlier, or how do you go about that?
Well, if you feel something, you're going to be able to be screened earlier, but a lot of it is insurance driven. The other thing that you need to know too is if you have like an aunt or even a mother, grandmother that had breast cancer, Whatever age they had the breast cancer, you should do your first mammogram 10 years earlier than that. And the insurance should cover that. So let's just say your mom had breast cancer at 48, and you should have your first mammogram at 38. And that should be covered because you want to do it 10 years before the person that had the actual cancer. And theoretically, we should start the first mammogram at 40.
Wow, that seems so early.
Mm-hmm.
But that goes back to knowing that family history.
Mhm.
And having that conversation with your family is so important. So, and you'd be surprised, I think, sometimes what you find out that people didn't, they don't maybe necessarily want to talk to. And then you get into a genetic counselor and you find all this family history and you're like, oh my goodness, this is so important, and leads to, some different testing and earlier screenings.
So we just mentioned genetics again. There might be this old wives' tale that it like skips a generation. Is that true or false?
I think that's really false. So I think that, and the thing about the BRCA1, BRCA2 is it's only 8% of the population has that. But certainly if there's a lot of family members that have breast cancer, and you always want to try to test the initial person that had the breast cancer. So it's nice to go in and say, well, there's a family history of breast cancer, but ideally, and you don't have it yet because you don't have any cancer yet, thank God. But it's hard to get that testing right away. But certainly that's where a genetic counselor comes in. And then she goes through your family history, your pedigree, and sees where all things are. And then she'll guide you into the right test. And then if you're a young person that comes in and you've never had, you don't know of any cancer in your family, but you're young and you've had breast cancer, you automatically get it. So you automatically get testing if you're 45 years of age or younger. Even if you're older, but there's 2 family members with breast cancer, automatic.
Does breast cancer spread, and where does it spread to?
Unfortunately, it does, and it likes to go almost anywhere. So bones typically first, but it can go to the liver, it can go to the lungs, and it can go to the brain, and it can even come back on your chest wall. And a lot of people think after they have double mastectomies, so they've had all their breast tissue removed, implants or no implants. So they think it can't come back because they're like, I don't have breast tissue anymore. It absolutely can. So it's just one cell that's remained that we couldn't see with our eye, that didn't get taken out, and that it goes and plants itself somewhere else. And so absolutely it can. Once it becomes metastatic, it's incurable, but we are doing better and better all the time. We have great medications now, and we're keeping women with metastatic breast cancer alive so much longer.
So let's talk about how you do that. What is a treatment for? And I know everyone's case is going to be different. There's probably no blanket answer, but how do you treat breast cancer?
So the most important thing people can know about breast cancer too is it's a surgical disease. So ideally, you want to have surgery. Sometimes we see women that have a very large breast mass, or it's very close to the chest wall. And so sometimes we'll do chemo or an anti-hormonal pill that cuts the estrogen to shrink the tumor so that it'll be a better surgery for the patient. But absolutely, it's a surgical disease. Now, if it's already spread to other parts of the body, then there is no reason to do any kind of breast surgery if it's already in the liver or the lung or the bones, because that would just be putting a woman through an unnecessary surgery and not a curative intent. So when you feel a mass, you'll go to the doctor, you'll have a biopsy, and then ideally you want to see a surgeon, and then sometimes an oncologist, and then they can make the decision together if go to surgery or do we need to do something before you go to surgery. But absolutely, it's a surgical disease.
So if you are going the surgery route, if it hasn't spread yet, how do you know if you need a mastectomy or a double mastectomy?
It depends on the size. It depends on the receptors. So is it triple negative? Is it HER2 positive? A lot of it is a patient choice. Sometimes the patients just want to go ahead and they don't want to deal with having mammograms, being worried all the time, potential biopsies in the future. And sometimes they just want to go ahead and have a mastectomy. But you'll have that conversation with your either oncologist and or surgeon.
You mentioned, though, earlier that the mass could be up in the armpit, which makes me think like thyroid. But you're saying that's do we still have breast tissue up there? Is that what it is?
There's a lot of lymph nodes there. And so a lot of times they're fed by the breast cancer. And so sometimes you feel it in your axillary lymph nodes before you even feel it in your breast. So again, another way just to be aware of your body, like when you're showering and checking those kinds of things. And sometimes if you feel a lump under there, that needs to be addressed as well.
So this is a women's focused podcast, but we do probably need to help educate people that men also have breast tissue, even though theirs isn't as maybe voluminous as ours. Um, so again, I mean, as women, we take care of our men, and so this is not just something that women should be thinking about, right?
Correct. So the incidence of men, though, it's less than 1%, so it's very, very tiny. But I bet we have 5 or 6 men in our practice right now, which, obviously is predominantly female. But yes, and it's the same thing for them. They go through. They can have a lumpectomy, just part of it removed. They can have the whole breast removed, and same kind of thing, radiation and antihormonal pills, and they'll have the receptors checked. But it's just not as common. But absolutely, it is there. So yes, need to be aware.
So can they find it the same way, just feeling a lump, or how does that
They're going to
work?
feel a lump probably way more than we do because they're not going to get screened routinely for mammograms, obviously. But yeah, when they feel a lump or a mass that's, not something they've had before, definitely need to get checked, and then they will absolutely have a mammogram and do all the things that women do. They're just not going to be screened like that routinely.
Okay, so can you be cured from breast cancer, and what does remission look like?
Yes, you can. The earlier we catch it, the better we do. And usually you'll follow with your oncologist for the first 5 years or so, and then sometimes we will let you go on to your primary care doctor, and as long as you continue to have, if you still have breasts, that you still have your mammograms, and then, of course, if anything were to show up abnormal, or you can always go back to your oncologist. Some oncologists wanna keep you for your whole life, but, I don't know how realistic that is anymore, but certainly, yes, and you live a normal life, and then you're screened just so that in your first years after you've had breast cancer, sometimes you may have a mammogram on that affected breast every 6 months, and then the other breast once a year. We usually do that for about the first 2 or 3 years. Then we go back to routine screenings just once a year, and then after 5 years, you'll go to a screening mammogram after that, and yet you'll just be followed like a routine healthy person.
I think we want to think in our fairy tale world that if you have cancer and it's treated and it goes away, then it will never come back again. But that's probably not always the case. So, can cancer come back again, especially for these women who get it so young and they go on to live another 40, 50 years?
Absolutely. Unfortunately, that's very true. So you want to continue your surveillance and your screening, and you just want to be on top of things because absolutely it can come back. Now, we have survivors that, are way out and have never had it come back. And then you have people that have had that come back, or they get a different kind of cancer. So you just want to stay vigilant just because of your history. And it doesn't mean you'll ever get another cancer ever again, but you just never know, and you certainly can.
Is there anything else that we maybe didn't talk about that you think is important for women to know about breast cancer?
I just feel like I think the most important takeaways are to lead as healthy a lifestyle as possible. Also the risk of increased breast cancer too has to do with uh, extra estrogen exposure in your lifetime. So the earlier you are when you start your menstrual cycle, the more people are delaying having babies. And of course, the age that you go into menopause, of course, that's going to be an older person. Obviously, it's going to be a young person. So yeah. But I think the most important thing is just honestly, just trying to lead as healthy as a lifestyle as you can personally, knowing your family history and checking your own body. And if you feel anything abnormal, we're always happy to say, hey, that's nothing, or do a mammogram or do a biopsy, and it's negative, and we're so happy. But it's so much better to have that than to have something be very large now and maybe potentially spread because you were afraid to seek some attention and get some help, because we can do some great things with breast cancer. The field has gotten so much better, and there's so much research has been done, because of the Komen and all the different things. And so it's not as horrible of a thing as it used to be, but we can always do better.
All right, ladies, you have your assignment. Self-checks, live a healthy lifestyle, and go talk to your parents. So, all right, it's time for that part of our show where we have you choose a trending topic and you kind of dive in a little bit to it.
Okay.
So let's see what your trending topic is today.
Dense breasts and alternative screening options.
Okay, so we dived into this a little bit earlier, but what are you hearing is up and coming about kind of our options? I feel like maybe you guys are constantly innovating in the realm of breast cancer. So are there any cool things coming up when it comes to
I think
checks?
that it's coming, and there's technology out there. It hasn't been adopted yet, But the whole problem is the reason we don't do mammograms on 20-year-olds is because their breasts are so dense, you can't see a cancer. So it would be a completely waste of time. We thought that as you got older, your breasts became less dense, but what we're finding now is older women have dense breasts as well. So they're actually grading the density of your breast, which is really confusing for some women because they actually get that on the mammogram and it tells you how dense your breasts are. So the technology my sister had sent me some interesting video of a new different kind of a mammogram because a dense breast looks like white. So it looks like a snowstorm and you can't see anything in it. And this particular new technology that they're testing out completely takes away the snow, as we call it. And then you could actually see a mass that you wouldn't have been able to see before because of the density of that person's breasts. It's brand new technology. So it's being tested to see, is it worth it? Is it going to give us information? Is it going to be valuable? And so I think something like that's coming in the future. Right now, you might have to have an ultrasound behind your mammogram because your breasts are dense, or even maybe possibly an MRI, which is a very expensive test. But again, it goes a little bit deeper so we can see if there's anything that's abnormal. So I think in the future, we're going to see something different based on the category of your density, what tests you might be able to get.
Great information.
Yes.
Yeah.
Well, thank you, Darla, for being with us today.
Oh, well,
And
thank you.
yes, and thank you all for listening. If you have any topics you'd like us to cover, you can find us at our Covenant Health social medias, and we'll see you next time. This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician. We all wish we had the recipe for the perfect night's sleep. With all the trends circulating on social media, it's hard to know what really works. Let's uncover the best practices for waking up feeling truly rested and refreshed.